Dit is môre wêreld-breinvliesontsteking-dag en die mediese hoof van Sanofi Pasteur Vaccines, Dr. Nasiha Soofie, kuier vanoggend saam om meer hieroor uit te brei. So good morning, doctor, and thank you so much for joining us.
Thank you for the opportunity.
Doctor, I would like to start with the fact that World Meningitis Day is coming up tomorrow, the 24th of April. So please just tell us a little bit more about what invasive meningococcal disease, or IMD, is.
Okay, so invasive meningococcal disease is a bacterial infection. The name of the bacteria is Nasseria Meningitis. And this bacteria is incredibly aggressive. So what happens is, for instance, if you are sitting with someone who has the bacteria in them, if they are carrying Nasseria Meningitis, if they cough or sneeze, or if you happen to share the same eating utensils, the bacteria can spread from that person to you. And when the bacteria gets into your system, it then spreads very rapidly. It can enter into your skull cavity and it can cause an infection of the lining of your brain, which is referred to as meningitis or meningococcal meningitis. Alternatively, it can also get into your bloodstream and cause a meningococcemia. Now, both forms of invasive meningococcal disease are very, very aggressive presentations. When a patient is infected with Nasseria meningitis and the bacteria proceeds to become invasive meningococcal disease, it's incredibly difficult to manage, and treatment is not a guarantee.
Now, IMD has non-specific signs and symptoms, and something that I find very interesting is the fact that by the time it is diagnosed, it is sometimes too late. So can you tell us what some of the symptoms are that one should be aware of?
Absolutely. So whilst this bacterial infection proceeds very quickly, within hours of being exposed to the bacteria, a person may die. That means that the healthcare professional, your doctor, needs to be very quick in making the diagnosis and administering the treatment. But this is the heart of the challenge. It's almost impossible to diagnose invasive meningococcal disease in the early stages. And the reason for this is because when the person starts to present with symptoms in the early stages, the patient looks like he has the flu. So very often these patients, when they become ill and they go to see their doctors, they are misdiagnosed and they are sent home. It's only 10 to 15 hours later when they start presenting with the more typical signs and symptoms of a meningitis, like a stiff neck, a throbbing headache, photophobia, meaning fear of looking into light because the eyes will pain. It's only 10 to 15 hours into the infection when they start presenting with the more typical signs and symptoms of meningitis, then only does the doctor start thinking about meningitis. But at this stage, it's too late to treat.
Oh, wow, that's very concerning. How is IMD spread?
So invasive meningococcal disease is spread by a bacteria, Nasseria meningitis, and this can be spread similar to other respiratory infections. For example, coughing, sneezing, social activities like kissing, sharing the same eating utensils can all facilitate spread of the infection. But more especially, those who spend lengthy hours under crowded conditions are more at risk, because the more crowded an area is, the easier it is for an infection to spread from one person to the next.
And how can it be prevented?
So for Fortunately, as South African citizens, we are very privileged to have available to us in the private sector a best-in-class vaccine. So we do have a meningococcal conjugate vaccine that is available in the private sector. This is the same vaccine that is used in first world countries. It's a broad spectrum vaccine that protects against most of the strains of Nasseria Meningitis. So I would suggest if you are a parent who has very young children, especially children less than 2 years of age, if you have children who are going to creche, who are going into primary school, high school, students who are going into tertiary institutions, living in dormitories, all of these individuals are at risk. Even you yourself, I would strongly advise, if you have not received the vaccine, if your family have never received the meningococcal conjugate vaccine, to proactively engage with your healthcare provider, with your GP or your pediatrician or your nurse, and try and get a script for the vaccine and have the vaccine administered as soon as possible. The most effective form of preventing this devastating illness is vaccination.
Such an informative discussion, and I'm looking forward to the rest of it, so please stay tuned. Jy kan ingeskakel bly vir die res van daardie gesprek. Ons gaan voort met vanoggend se gesprek met Dr. Nasiha Soofie van Sanofi Pasteur Vaccines, na aanleiding van die feit dat dit môre wêreld-breinvliesontsteking-dag is, en ons brei so 'n bietjie meer uit na aanleiding van wat presies ons dan nou moet weet rakende hierdie spesifieke siektes. So, Dr. Soofie, thanks again for joining us this morning on the Groot Ontbyt. I would like to start, we've referred to some of the signs and symptoms and, how IMD can be prevented, but just in essence, maybe just to summarize it again, for those who only tuned in now, what should we be aware of?
Okay, so with regards to invasive meningococcal disease, this illness is an incredibly aggressive bacterial infection. What I mean by that is, unlike other illnesses like influenza or, whooping cough, TB, HIV, this illness, when it does happen, it tends to make news headlines. Anyone who's listening in, if they were to go onto Google and just type in meningitis, South Africa, they will find lots of articles of meningitis cases that were published in a number of South African newspapers. So this illness, what I'd like to point out is that even though it is not as frequent as HIV, TB, influenza, when it does happen, it is such an aggressive, dramatic infection that it makes news headlines. And the reason for this is because the bacteria is incredibly aggressive. Nasseria Meningitis, that's the name of the bacteria. It spreads very quickly. And within hours of being exposed to the bacteria, the individual may be left permanently disabled or dead. So it's so incredibly important that as individuals, we are aware of this aggressive, potentially fatal bacterial infection. We equip ourselves with as much information as possible and do everything we can to prevent the illness. Now, all is not lost. In South Africa, we do have a best-in-class vaccine that is available in the private sector. And this is the meningococcal conjugate vaccine, okay? And this vaccine is available at your pediatricians, as well as various pharmacies across the country. So I would strongly recommend that if you or your children, your loved ones, have never received the meningitis vaccine, the meningococcal conjugate vaccine, that you proactively engage with your healthcare professional. Talk to your doctor and say, I've heard this news clip about meningitis. Is there a vaccine to prevent meningitis? Can I have one? Can you please administer one to my children, for instance? Now, more especially, children who are less than 2 years of age. We know babies, their immune systems are naive. The immune system still don't know how to fight off infections, which means that children, babies less than 2 years of age, they are more vulnerable to get meningitis. But not only meningitis, any infection. Children less than 2 are always at a higher risk of getting infections, okay? Apart from COVID-19, which seems to be an outlier, and we're trying to understand that. But with regards to all other infections, including meningococcal meningitis, children less than 2 years of age are at a very high risk of getting the disease. So if you're a mom and you have a child who's less than 2, who has not yet received the meningitis vaccine, please make sure that they are fully vaccinated.
Now, Dr. Soofie, I'm so sorry to interrupt you there because, I mean, you've already told us where we can find more information, but I would like to focus on a day such as tomorrow. You know, it's World Meningitis Day, like we've already said. But what more can be done to spread the necessary awareness regarding this specific matter or disease?
So, you know, there is available on the National Institute of Communicable Diseases. So, you know, we have some very good resources available in the country. And sometimes we underestimate the potential of our scientists in this country. So the National Institute of Communicable Diseases, the NICD, has a very comprehensive website. And on the website, if you just were to type in nicd.ac.za, it will take you directly to the NICD website. If you were to just type in the search bar, meningitis or meningococcal meningitis, all of that information will be made available to you. But of course, this is not the end all and be all of awareness, which is why Sanofi Pasteur had a deep commitment to corporate social responsibility. Almost every year, we run these disease awareness campaigns where we invest hundreds and thousands of rands in ramping up disease awareness around meningitis. And this is really to complement the efforts made by the Department of Health as well. But also, to any healthcare professional out there, I implore you, I appeal to you, please, as healthcare professionals, please be proactive in engaging your patients on vaccination. How old are you? When was your last vaccine? And then do an assessment to see that the individual is up to date with all of their vaccines and are fully covered, not only for those vaccines available in the public sector, but also those vaccines which are available in the private sector as well, to ensure that your patient is fully secured against these debilitating infectious diseases.
Absolutely. Thank you so much for joining us this morning. Dit was dan Dr. Nasiha Soofie.